I'm Dr. Brian McCall. I'm an orthopedic surgeon. I've been in practice for 8 years. I did medical school at Georgetown University in Washington, D.C. I stayed there for my orthopedic training. I did my undergraduate work at Vanderbilt University. Orthopedic surgeons take care of bone and joint pathology, fractures, dislocations, arthritis, tears to tendons or ligaments. I specialize in sports medicine, so I do ligament reconstruction and a lot of arthroscopic surgery. Arthroscopic surgery is a minimally invasive technique where instead of using large open incisions and dividing through the muscle and going into the joint itself, we can use small percutaneous incisions and instruments that are about the size of the tip of a pencil to do the same work. We like to get people back to their function as quickly as possible. So even for major surgeries, we're keeping patients in the hospital much shorter periods of time. We use multimodal pain regimens, meaning that we use lots of different medications to minimize the pain even after major surgeries, so that our patients have little or no pain after those procedures and are able to return to a normal function much more quickly than they used to. We do arthroscopic repairs for torn ligaments, such as in baseball players. Occasionally they'll tear the ligament on the inside of their elbow, and that was made famous by a baseball player named Tommy John. So we'll take another ligament and put it into the elbow so that the baseball player can keep throwing. Within orthopedics, I enjoy arthroscopic surgery. I do Tommy John elbow reconstructions for baseball pitchers and throwers. I do arthroscopic, all arthroscopic ACL reconstructions. I also do joint replacement surgeries of shoulders, knees, and hips. I'm lucky to be on faculty for orthopedic surgery with the Arthroscopy Association of North America. I also do some consulting for a couple of the implant companies, so I get to see the newer implants as they're being developed, and I help teach courses to teach other surgeons how to do those techniques. I think we're fairly unique in the amount of time that we're able to give to the patients. In a lot of other orthopedic practices, you'll be seen by a physician assistant or other medical assistants, and you won't get as much one-on-one time with the doctor. Even if I'm running behind, once I'm in a room with a patient, I'm there. I will take all the time that's needed to address all the concerns fully. My practice philosophy, I treat most of my patients as I would want to be treated. I spend a lot of my time listening to what they have to say. If you're patient and don't interrupt patients, they'll usually tell you what's wrong with them. And then I spend a lot of time educating the patient about what their disease condition is and what options they have moving forward to fix it. I think that they can tell that I am sympathetic to what they're going through, that I'm patient enough to listen to what they have to say, and that I explain clearly what we're going to do. I don't think there's ever a time where I'm telling a patient what we're going to do. I give them the options of what we can do to make this better. The most rewarding part about orthopedics in general is that we get to take the pain away and the dysfunction away from whatever condition the patient comes in with. In a lot of other branches of medicine, you can't truly win. In orthopedics, we get to sort of defeat the problem. So it's very rewarding to take pain or injury away and restore that patient back to their potential and function.